Let's talk a little bit about, replacing teeth. Dr. Martinez, you have mentioned how devastating it can be to have missing teeth. Basically, you not only don't chew good, but you start losing other teeth because of it, and perhaps more importantly, your mouth might get out of alignment, and you might get headaches, back pains, all kinds of things. Either way, and you probably, I assume, perhaps also look a little bit more ugly and crooked, because the whole thing gets shifted, right?
Exactly. We tend to compensate. So
right.
That's very, very common.
Right. So let's talk a little bit about the 2 or 3 or whatever major ways which there are to replace the teeth. And give us a very short overview of each pro and cons of the major ways on how to replace the teeth. Will you?
Sure, I will let you know. The best way to replace teeth in this day and age would be considered implants. Implants is it's a titanium screw that's actually implanted into the jaw, and on top of that we put a post and a crown. And it is probably the state of the art. It's the standard of care. Consider the standard of care, and we have to let people know. I like the implant itself because you don't have to touch any of the teeth next to it. Traditionally, the second other option to do to replace missing teeth, are with bridges. And bridges, for whatever they are, they've been great tools to replace teeth since I've been a dentist, for sure, and even longer. But one of the disadvantages, I guess, if you will, would be to prepare for a bridge, you have to touch the teeth on either side. Which essentially you're condemning yourself, I guess, to always having a bridge in your mouth. If this bridge fails, the next time you have it replaced, you can only get it replaced with the bridge. So you're actually locking yourself into always having a bridge.
Or by pulling those 2 teeth, which you basically, when you said touching, meaning grinding them down to a little stick so that you can put a crown over it or a cap, as you call it, right? So if you then ever wanted to replace it, you would have to put 3 implants in it, right? Instead of just 1.
If you ever needed to replace the whole, let's say we're talking about a 3-unit bridge. Mm-hmm. The conventional 3-unit porcelain bridge that attaches to one tooth, then you have the missing tooth, and then attaches to the other tooth.
Right.
If you ever lost one of the attachments, you're essentially would be losing the bridge because that attachment would be gone. So then you're talking about possibly increasing and going to a 4-unit bridge to attach it to the one that's in front of this one. So if you can see what I'm talking about, if you can visualize it, I'm a very visual person, and I'm sorry I can't draw a diagram here, but if you see what I'm talking about, is you're already kind of you're saying, you're hoping that this bridge lasts, and it's, we do very good work, and we can say that it could last you 8 to 10 years, but you're already attaching yourself to another bridge if this one fails, or the porcelain doesn't look good, or the gums start receding and you need a bridge. Right. Now, the advantages of the implants are that they're separate entities. There are separate entities. If the implant would fail itself, it's only one entity that fails, not a whole 3-unit bridge. But again,
and by apparently proven track record over the last close to 20 years or something like that, an implant fails a lot less than a bridge. Is that true?
Correct. Because you're asking a lot more of your own body to retain an implant, where with a bridge you're asking a lot of your technician that's doing it, your dentist that's doing it, to make sure that you are provided with a very good sealed bridge. And then also home care. That's probably 75% of maintaining a bridge is how your home care. And people have the misconception also that as long as you have a bridge, or as long as you have a crown, or I just had a filling done 6 months ago, that you cannot get a cavity anymore. And that is really totally wrong. As long as there are teeth in the mouth, or tooth structure in the mouth, it doesn't matter if you leave bacteria in there, you will get recurrent decay. And this is where most of the failure of a bridge comes from. And people don't understand that it doesn't matter how good of a bridge we do, it's home care that is primarily the most important part of it.
In fact, Tell me whether that's true. If you have a bridge, so you have two teeth, you grind them down, you put a cap over it, and you hang a third tooth in between, or for that much two teeth in between, whatever it might be, that area is kind of one, almost like a melted or welded piece together, and it's very difficult to floss there because there's nothing to go in between, which apparently, if the home care, if a guy like me who's a little bit on the slappy side, again, like my wife is chewing the first piece of steak while I have it all finished, she also is still brushing teeth when I finish showering and shaving and all kinds of things. So for me to fiddle on a bridge and clean the gums, let me tell you, I would probably miss it more than half of the time because I would just be too lazy, and that would bring me gum disease in a major way, and which would make the bridge failing. Yes or no?
That could potentially, yes, you're absolutely right. And yes, that could potentially lead to all the issues I was talking about, where gum disease or recurrent decay on these teeth. But, when you have I don't want people to get deterred from having a bridge done as well. Bridges, when they're done properly, there's enough room for you to floss, there's enough room for people to keep the gums clean and all that is done. It's just that you are compromising the teeth next to it, and you're by the fact that you're attaching to them. So the care has to be extraordinary. And yes, maybe guys are not as good as when it comes to taking care of their mouth when flossing and brushing. And you do have to use floss threader. So people sometimes they say, no, I really don't want to go that route. And then the third way of replacing teeth, which is also very commonly done, but it's not just replacing one tooth, is with partials, removable partial dentures. And typically the removable partial dentures are made for people that are missing several teeth. It really doesn't make sense to replace one missing tooth with a partial. Although I've seen it, because people don't want to end up having to have the other teeth ground down, as they say. But I've seen them, but I think it's really not the best way. It's a good way if you have no other choice, because we want to retain the space. We were trying to maintain all the functions that we already discussed, but it isn't the best way. It is one of the better ways financially to replace teeth if you're missing a few teeth. And also, again, a lot of insurance companies still to this day are not covering a lot of the implant treatment. They're leaning more towards the fixed bridges that I talked about or the partial dentures. And a lot of people, of course, see that as which is unfortunate, but they have to see that, the first question they ask is my insurance going to cover it? And they pretty much determine what treatment they're going to get based on what the insurance is going to cover.
Sure. I got it. Well, that gives us a very good overview. So we have the high and latest technology, which is already 10, 20 years old also, which is implants. We have crowns and bridges, which have done for a very long time a very good job. And based on what you say, still do a very good job. You just need to be then a little bit more big-headed in terms of maintaining your teeth. That's a little more difficult, but definitely can be done. And they do a good job. They fail on an average a little faster than the implant, is what you say, simply to the structure. It can't hold so much so long, and that's all there is to it. And then we have the partial, which is, at least putting the teeth in and at least keeping the space between the teeth while they're missing. Thanks a lot, Dr. Martinez. Thank you very much.
Thank you.